So, Ali, I understand that you have a master of acupuncture and Oriental medicine. What does
Yes,
that
that's
mean?
correct. So, a master's of acupuncture and oriental medicine means that I went to school, grad school, after I finished undergrad to study Chinese medicine, which includes acupuncture, herbal medicine, also a lot of manual techniques, tuina, medical massage, and a lot of natural, traditional ways of healing people.
And would you say most of that is directed for preventive, or is that in care of?
Both. It can be used for both preventative medicine and
Mm-hmm.
also acute care. You know, I see a lot of pain patients here, a lot of gastrointestinal issues, headaches, chronic pain issues, but also just for prevention, for stress management. Also allergy management, people who have had issues with allergies and want to keep them at bay
Mm-hmm.
have used acupuncture. Yeah.
So how does it work? What's the physiology of
So the
acupuncture?
physiology is, you know, it's kind of like the same way how we have blood vessels going up and down our body, we have nerves going up and down our body, we have lymph going up and down our body. We also have energy going up and down our body. And this energy in TCM is called qi, and the acupuncture is used to stimulate certain points on the body that are used to initiate flow or balance in the qi. Right now, physiologically, we found that in acupuncture points, there are these places on the body that have clusters of different hormones, and by stimulating those points, you can initiate a response in the brain, and that response in the brain can initiate healing in the body. So that's essentially how acupuncture works. It's kind of like flipping on a light switch on one side of the room and turning on the light on the other.
So it works for both pain management, and I understand that it's also effective to assist with the immune system, particularly helpful for people who are undergoing chemotherapy.
Yeah, so I think the World Health Organization has a long list of like 150 different conditions of which acupuncture is effective for. Pain is the most common one, but also nausea related to pregnancy and chemotherapy, also maintaining a strong immune system while you're having chemotherapy is also acupuncture can also be very useful for that. Also, gastrointestinal issues, sciatic pain, a lot of nervous system issues, stroke management.
Does it help with sinus?
It can also help with sinuses. Allergies are a little bit hard to
allergies.
treat, but they can be treated with acupuncture. I've had some patients who've done acupuncture have had chronic lifelong allergies and have done acupuncture consistently for a year and never had problems with their allergies again.
Okay.
So it can be used for allergies.
Okay, and then is it painful?
No, it's not painful. You know, I always tell patients it's not a sensation-less medicine, so you'll feel something, but it's not pain. The needles, sometimes you can have a small pinch at the injection site, but it's not like drawing blood. The needles that we use to draw blood, they're used for cutting. These needles aren't used for cutting. They're just used for penetrating the skin. Usually patients, they might say they don't feel anything at all, and some patients, they feel kind of a deep ache, kind of like when you're getting a massage and you kind of get to that good spot. That's really what patients feel. If ever it's close to a nerve or something like that, then patients will communicate that with me and we just adjust the needle.
How many needles do you usually use in
It
a session?
depends on what the patient is coming in for. I would, sometimes I use one needle, sometimes I use 20.
Okay, are there risks?
Yeah, so anytime you're inserting a foreign object into the body, then you'll always have a risk of infection, bleeding at the site. Sometimes you have bruising there as well. That's pretty much it, is infection.
But generally, that's not. I mean, that's not a common concept.
No, it's not very common, and the needles that we use are sterile needles. We use a guide tube, we use gloves to keep the procedure very sterile, and usually patients tolerate it pretty well.
So you are also a physician assistant, a PA.
Yes.
How do you find the two disciplines support each other? Or...
Oh yeah, I mean, so I was trained in acupuncture originally, I grew up in a medical home where my dad was an MD and went to China and Korea and Japan to study acupuncture and kind of integrated that into his primary care practice. And I kind of grew up in that whole environment and atmosphere. And when I went to grad school, I originally wasn't going to do Western medicine. I was just going to do Eastern medicine and acupuncture. And I found that in medicine, the more tools you have, the better you can, a better care you can offer to your patients. And I think that that's the strength in doing both acupuncture and Western medicine, because you can always ask yourself the question, well, what can I do to help my patient the most and hurt them the least? And I find it really empowering to do both. Sometimes it's really useful to be able to tell a patient, okay, well, I can put you on this medication, but we can also do these types of exercises, this type of massage, qigong, tuina, and all these things are going to help support whatever medication that they're on.
Oh, that's terrific.
And also, I think that sometimes with people with more severe cases that aren't addressed with acupuncture, it's kind of nice to have an additional set of tools so that if ever the natural options are exhausted, we can always use, traditional options as well.
All right. Well, thank you very much.
Thank you.
Okay. Bye-bye.